you for standing by. At this time, participants' lines are in a listen-only mode. To ask a question during the question and answer session, please press star 1 on your touch-tone phone. Today's conference is recorded. If you have any objections, you may disconnect at this time. I will now turn the meeting over to Ms. Danielle Nelson. You may begin.
Hello and thank you. Welcome everyone today to today's webinar. We'd like to apologize for giving you the fax number that you first initially tried to dial in with. That was my mistake and I do apologize. But we're glad you're able to be on here now with us. And we'd like to welcome you to the Graying of HIV/AIDS Community Resources for the Aging Network. Today's webinar will be recorded. If you've missed any portion of it, we will have it archived on AOA's website 7 days following today's webinar. So you're welcome to view back in and also pass it along to others. Our website is www.aoa.gov, and then when you get there is a button on the right-hand side of the home page that says HIV and Aging. That will direct you directly to this webinar, as well as our toolkit, which you'll hear more about later. So here's today's agenda for our webinar. We have 5 speakers that will present during today's webinar. The presentations will last 15 minutes, and then we will take your questions. Our webinar is scheduled to last 1 hour and 15 minutes total. You can enter your questions throughout the webinar via the chat function in WebEx. We will answer these questions through chat during the Q&A session. Also, during the Q&A time, we will open up the audio lines to take some questions over the phone. Should you not have a chance to get your questions answered today, I welcome you to email me directly. My email address is danielle.nelson, that's spelled DANIELLE.NELSON @aoa.hhs.gov. Today's presenters, I would like to express a sincere thanks to each of you for being here today and taking the time out of your schedule. Dr. Charles Inlet is a professor of social work at the University of Washington, Tacoma, and he is affiliate faculty with University of Washington Center on AIDS Research. Our second presenter today is Joan Devon. She is the Healthy Aging Project Director at the Area Agency on Aging in Palm Beach, Florida, also known as PSA9. Deanna Traviosa Palo is the HIV Education Branch Chief at the Division of Training and Technical Assistance within the HIV/AIDS Bureau at the Health Resources and Services Administration, also known as HRSA. Aisha Moore is the Communications Director at AIDS.gov. And today's last presenter, but not least, we will hear from Carol Creasy, who is the Director of the Office of Outreach and Consumer Information at the U.S. Administration on Aging. Before we get started with our first presenter of today, we would like to share with you our toolkit. The Administration on Aging developed a toolkit that would serve the older adults in communities. And so we'd like to start off today by sharing with you what is a video that introduces that toolkit. So here is our Assistant Secretary for Aging, Kathy Greenlee, introducing that toolkit.
I'm Kathy Greenlee, U.S. Department of Health and Human Services. The Administration on Aging is the federal advocate for older adults, and we are committed to providing the necessary information and resources so they can live healthy and active lives. It's important as we talk about health and wellness, we also talk about HIV/AIDS. According to the Centers for Disease Control, people over the age of 50 account for 23% of AIDS diagnoses in the United States. And beginning in 2015, over half of the people living with HIV/AIDS in the United States will be over 50. The risk for HIV/AIDS doesn't stop at 50, yet older adults are often overlooked in this important conversation. That's why I'm proud the Administration on Aging developed a toolkit for our Aging Network partners and other organizations interested in educating older adults about HIV and AIDS. It's called Know the Risks, Get the Facts. With easy-to-use resources like posters, fact sheets, and videos, this toolkit will be a valuable resource as you reach out to older adults in your community. It's important that everyone together we can make a difference in the fight against HIV and AIDS. Thank you.
That video will be on the AOA website, so you can hear it much clearer when you view it later. So we would like to now turn things over to our first presenter, Dr. Charles Inlet.
Thank you, Danelle. Good morning, everyone, and thank you for being involved in the webinar. What I'd like to do for a few minutes is to talk about the graying of HIV/AIDS and its implications for community programs. Next slide. So today you're going to hear a lot about how dramatically HIV disease is growing in the population of adults 50 years and over in the United States. This is occurring due to a combination of factors, including a growing number of older adults with new diagnosis of HIV infection, as well as long-term survivors. And this survivorship is due to the effectiveness of highly active antiretroviral therapy. This dramatic increase is underscored by the estimate that you've already heard that by the year 2015, half of those living with HIV disease in the United States will be 50 years of age and over. Next slide. This slide graphically shows the dramatic increase in the number of older adults with HIV disease in the U.S. According to CDC data, in 2004, approximately 105,000 individuals 50 and over were estimated to be living in the U.S. with HIV disease. By the year 2008, this estimated number had increased to 209,000. Considering the largest proportion of HIV cases in the United States by age group are those 40 to 49 years of age, this trend is likely to continue for the foreseeable future. Next slide. With the growing number of older adults living with and being impacted by HIV disease, it's important to understand if the Aging Network, those services established under and funded by the Older Americans Act, are prepared for this demographic. In 2008, we received a grant from the University of Washington Center for AIDS Research in order to gather some initial pilot data to answer that very question. A 36-item questionnaire was developed for this purpose and pilot tested with Area Agency on Aging staff, a AAA director and a case management supervisor from another state. With help from the Washington State Association of Area Agencies on Aging, the questionnaire was sent electronically to all 13 AAAs in Washington State. The AAAs received electronic reminders over a 2-month period, and we ultimately had a 100% response rate from all the area agencies on aging in the state of Washington. Next slide. This slide summarizes some of the primary results from that survey. We asked AAA personnel if they felt serving adults with HIV disease was consistent with their mission. And as you see, the vast majority, over 90%, agreed or strongly agreed with that position. Effective service delivery to older adults with HIV infection may require coordination and collaboration with AIDS service organizations. The survey results found that almost 2/3 of the AAAs in Washington currently interact with their area's AIDS service organization. However, 60% felt that collaboration could be improved. As part of the survey, we gathered some more subjective data or comments. An important comment came from one of the rural and tribal AAAs, and they asked why we assumed that an ASO or an AIDS service organization was available in their geographical area. It's important to remember that not all regions have ASOs, which could increase the pressure on AAAs in those areas to provide increased services. We We asked AAAs about the experience their agency personnel had in serving this population. 2/3 stated they had limited experience, and 1/3 had no experience working with older adults with HIV disease. While the majority of AAAs in Washington had some training in HIV/AIDS, over 80% stated they desired to learn more about aging and HIV. The majority felt this could be accomplished through written materials, with slightly under 2/3 wanting in-service training. 30% felt that case consultation could be extremely helpful. Next slide. Our study found that most area agencies on aging in Washington believe serving older adults infected with and affected by HIV disease is within their agency's mission. Most feel AAA's and AIDS service organization collaboration could be improved. It's important to consider geographical areas where ASOs do not exist and how area agencies on aging might meet those needs for older adults impacted by HIV disease. It was clear that area agencies on aging in Washington State felt more information and training on aging and HIV was needed, which is why the release of the Aging and HIV Toolkit created by the Administration on Aging is so timely and vitally important. I want to thank you for your interest in this topic. The full results of this study was published in 2009 in the Journal of Gerontological Social Work, and I believe if you want to get a copy of that full study, you can contact Danielle for a reprint. Thank you very much.
Thank you very much, Dr. Inlet. And I should mention it was this article is how I found you to be a speaker today. So again, we appreciate your time, and we'd like to now turn things over to our next presenter. Joan, are you on the phone?
Yes, I am.
Wonderful, Joan. I'd like to pass things over to you. Please take it away.
Thank you so much, and thank you, everyone, for being part of today's webinar. As a brief introduction to my comments today, I just like to take a few extra moments to further acquaint you with our agency. As you already know, our Area Agency on Aging is in Florida. We're located actually in South Florida, and we cover a 5-county area. This is an area with over 560,000 seniors, 60 plus. The largest of these counties is Palm Beach County, where I am physically located. Our offices are physically located. And in Palm Beach County, we have over 360,000 seniors, which represent 28% of our population here in Palm Beach County. I think what's prompted our agency to take action is the latest data that we have access to. Next slide, please. Thank you. In Florida, heterosexual men and women 50 years and older are the fastest growing demographic for new HIV infection. South Florida also ranks the third highest in the areas out of 50 states in cumulative reported HIV and AIDS cases. And finally, in Palm Beach County, it was absolutely alarming that 1 in 4 new HIV cases diagnosed occurs in adults 50 plus. Well, these statistics are of great concern, and they have really given us pause to reflect on how our agency can mobilize limited resources to reach medically underserved, higher-risk seniors through our outreach activities. And our agency's Healthy Aging Center of Excellence, of which I am the project director, conducts health promotion, health screenings, disease information, and prevention programs, all under the Title IIID Older Americans Act funding. Our Healthy Aging component is ideally and generally on medically underserved. the highest risk seniors, 60 plus, and we really work very diligently to reach the lower income, the people who are so at risk and vulnerable, medically underserved, and we do seek out minority groups who tend to have more challenges and barriers to healthcare and healthcare access. In response to this growing number of seniors that we were hearing and seeing being affected by HIV and AIDS, or at risk, potentially at risk of HIV infection, we, this past year, initiated a collaboration with a local community health center within the city of West Palm Beach. Now, this small community health center has a grant to provide HIV and AIDS testing and education, and we just thought that this was an ideal type of collaboration. This was a huge focus for them, and this was a need for the population that we were serving. So our health screenings, since we've been collaborating with them in the city of West Palm Beach, we are specifically targeting faith-based venues and low-income housing communities. This has really enabled us to reach the highest risk group of seniors who we know that would benefit from HIV and AIDS education. The health screening activities now include HIV, AIDS testing, as well as typically what we were doing before with the blood pressure, the blood glucose, the hearing, diabetic foot exams, and disease information and prevention that seniors had typically come to know and to rely on those services. The Community Health Center has just gone out of their way to provide the medical team, the HIV, and the AIDS counselor to us. This has been such a mutually beneficial type of program. They were having problems finding the number of seniors that they need, that access to seniors, and this was a need that we needed met, and it was just a perfect relationship that came together. I want to add, too, in closing, that as part of this requirement for testing, because HIV and AIDS testing is very different than what we were used to doing generally, typically with health screenings, we insist and work with the venues to have dedicated areas for the testing and the counseling that protects the client's privacy. The medical staff from the Community Health Center, they distribute safe sex materials, including condoms, literature. They literally walk the seniors through this material and explain it, knowing that literacy is a huge problem for many, many people. And they also provide follow-up counseling and healthcare access, because this is a group, too, that was very, very medically underserved, and many of them did not have a medical home. Many of the seniors 60-plus are not yet Medicare age, and that was what we were seeing in the HIV population. So this Community Health Center has been able to give them a wraparound type of care and healthcare access, and it's been an incredible experience for us. Our next goal is to expand this outreach now to the entire county and in the rest of our planning and service area, which includes 5 counties, by partnering with local community health centers, the federally qualified healthcare centers that are located throughout. I think that we've done something very small, but it's very large in that it just creates a model that we can work with our partners in doing what we all do best. So thank you all. Thank you all for giving me the opportunity to share this story with you.
Joan, thank you so much for being here today and sharing that information with us. We'd like to now introduce our next speaker. Our next speaker is with us today from HRSA. Her name is Deanna Travieso-Palo. And so I'd like to pass things over to our next presenter.
Thank you, Danielle. Good morning or afternoon, depending on where you are in the country, and thank you for joining us for this very important topic. Next slide, please. as was mentioned, I work in the HIV/AIDS Bureau within the Health Resources Services Administration. We are very much associated. Most of our programs are funded through the Ryan White programs, and I wanted to kind of support what has been said previously by the two previous speakers, the fact that we are seeing a large increase of individuals living with HIV that are older adults, and there are multiple cohorts within that group. Some have been living with HIV and not known it, but have been recently diagnosed. Some have been diagnosed and infected recently, and some, a very large group, as Dr. Inlet mentioned, are aging into this group, of this age group, because of being survivors with living with HIV, because of the fact that we have highly active antiretroviral therapy for them. And then to also piggyback on what the previous speaker just mentioned in terms of counseling and testing and identification of people living with HIV, historically, a lot of individuals who are older were actually not tested, did not know their HIV result, because no one thought to ask the right questions or to test them, and there was this paradigm shifted to some degree when the CDC provided us with some guidelines with prevention with positives, and said that anyone from age 13 through 64 should be screened for HIV at least once, and then obviously if they're high risk, more frequently. So this helps to have the normalization of counseling and testing as part of routine medical care. So when a patient or an individual goes to see their primary care provider, if they've never had an HIV test, this is something that is encouraged, that they have at least an initial one, and then obviously if they're high risk, that this be repeated more frequently. But as time has passed, the HIV/AIDS Bureau has become very much aware that there is this graying of HIV. We had a newsletter that we put out called the HRSA Care Action in February of 2009, and it recognized that there is an increasing prevalence of older people living with HIV and AIDS, and this is an issue of growing concern for various reasons. First of all, what are the best practices for caring for older people living with HIV and AIDS? Most of the information that we have or have had until very recently has really been more anecdotal. There were providers in the Ryan White group that were in clinics and so on that were providing care for people living with HIV and AIDS, but which were older, but there wasn't any scientifically based information or of best practices. So that slowly is beginning to change. We're beginning to get some guidelines or guidance, and I'll speak. One of the things that also was of concern to us is, do different cohorts of older people living with HIV and AIDS have different clinical needs? In other words, if you are somebody who has had HIV for 5, 10, 15, 20 years, and you're now aging into this older group, are your needs physically and psychosocially different from those of somebody who is recently infected and needs to come to terms with the diagnosis, comes to terms with, the changes that having this disease portends. And then because of that, we have had a concern within the Health Resources Service Administration, HIV/AIDS Bureau, and many more of our grantees are looking at that. The AIDS Education and Training Center, for which I'm the branch chief, we are the training arm for the Ryan White grantee community. So the AIDS Education and Training Centers continue to provide education and trainings on this topic to target audience of clinicians. So we provide clinicians with information so that they can indeed be better caregivers. Next slide, please. provide clinical training for providers. It is the training component of the Ryan White HIV/AIDS program, and our goal is to increase the number of educated and motivated providers to diagnose and treat people living with HIV. In the period from July 2009 to June 2010, the AETCs delivered over 50,000 hours of training to over 67,000 healthcare providers during over 18,000 training events. So as you can see, we have multiple events to provide training to clinical providers. Next, please. Next slide, please. This is a depiction of where the AIDS education and training centers are. We have 11 national AIDS education and training centers and 11 regional and 5 national AIDS education and training centers. As you can see, we covered the whole United States plus the territories. So that we will address more of that in a minute. Next, please. Next slide, please. Thank you. No, back. Sorry. Thank you. These 11 regional centers work with 130 local performance sites throughout the United States, all 50 states and the territories. The focus of training is on clinicians, that is physicians, nurses, nurse practitioners, physician's assistants, pharmacists, and oral health professionals. However, a minimum of 20% of training targets other members of a healthcare team, for example, case managers, social workers, mental health care workers, substance abuse treatment workers, and so on. But the primary focus of training is on the clinical providers. Next, please. The training topics vary greatly, and we have on list over 40 training topics that are routinely presented by the AETCs. There are additional topics that can be requested or sometimes driven by the HIV epidemic or the clinical management, because HIV clinical management changes with a fair amount of frequency, and so we want to make sure that the clinicians have the experience and the expertise to manage this kind of care. There are various types of training. There's didactic, which is more of a lecture-type situation, skills building, where there's perhaps case presentations and there's more interaction with the audience. The level 3 is clinical training, which is usually when a provider has the opportunity to care for people living with HIV and AIDS in conjunction with an experienced provider or mentor. So it's like hands-on kind of training. There's level 4 is group clinical consultation, where there is information provided to a group, perhaps several providers in the group and so on. And there's technical assistance that can be to an agency or to the provider. I'd like to mention here that, as was mentioned previously by the previous speaker, that providers wanted more information. They wanted to perhaps get assistance in terms of consulting for cases, how to manage them, and training. The AETCs are able to do all of that. They can provide information as requested. They can do case consultation, clinical consultation, and they also can provide training. So this is something that we're very much on our radar screen, and that this is a population and a situation that needs to be addressed, and that's the caring of people living with HIV and AIDS who are older adults. Next, please. Next slide. Oh, thank you. Something that, in terms of to note that we have, although all of our AETCs do provide training, of note is we have the AETC National Resource Center. This is one of our national centers, and it's a repository for curricula and all kinds of information and so on. So just and at the end of the presentation, you'll see the website that you can access. And there you will see there are multiple resources for trainers and clinicians, curricula, slide sets, guidelines, and et cetera. Also, one of our regional AIDS Education and Training Center, the New England AIDS Education and Training Center, holds an annual very well-attended conference. This is kind of a sequela to the National Association of HIV Over 50, which formed in years past, and they continue to have this conference every year, and it's extremely well-attended. Last but not least, another resource is the Target Center. This is a technical assistance for Ryan White community, and they have archived presentations, they have information, all kinds of things that you can access to assist in caring for people living with HIV and AIDS, and as you can see, there's the website. Next, please. And as I was mentioning, until recently, we really haven't had a whole lot of sort of state-of-the-art guidance as to how to care for people living with HIV over 50. Recently, the American Academy of HIV Medicine has made some recommendations in terms of treatment strategies. There was collaboration between not only the American Academy of HIV Medicine, but also AIDS Community Research Initiative of America and the American Geriatric Society. And this is very important because as HIV has become a more chronic disease, it needs to be managed by primary care providers whenever possible. And historically, the HIV treaters, those clinicians who had the expertise about HIV, may not have had the expertise or the comfort level to work with primary care, and specifically with older adults, and thus this is a very nice collaboration between the HIV treaters and the treaters for older adults. This particular tool was disseminated through the AIDS Education Training Center networks as a resource for training, education, and technical assistance to clinicians caring for older people living with HIV/AIDS. Thank you. In conclusion, this is my contact information, and as I mentioned, one of the things that the AIDS Education Training Centers can do, either the regional training centers or the national training centers, is that we can provide information, case consultation, and training as requested. So thank you very much.
Wonderful. Thank you so much, Deanna. We appreciate your time today. I'd like to now introduce our next speaker, who is from AIDS.gov. Our next speaker is going to share a great resource for your organization, and one that we at AOA use on our Elder Care Locator website. So without further ado, I'd like to introduce Aisha.
Good afternoon, everyone, or good morning if you're in the West. My name is Aisha Moore, and I'm here today to talk about the AIDS.gov HIV Prevention and Services Locator. So if we go to the next slide, I'll kind of explain to you all of the resources of AIDS.gov and then go further into exactly what the locator is and how you use it. So AIDS.gov is the federal portal for HIV information and information about the National HIV/AIDS Strategy. So this is a screenshot of our website, and as you can see, we have on the right-hand side, we have a AIDS.gov blog, we have video podcasts, we have information about federal resources, HIV/AIDS basics, and how to use new media. So on the next slide, I will show you more about what this HIV Services and Prevention Locator is all about. So as you know, many websites, you can go to them and you can type in your zip code and you can find information about providers and services here. So we have one here from CDC, HRSA, SAMHSA, and HUD. And so what we did was we took our federal HIV/AIDS Web Council and we all got together on an interagency product, and that resulted in one locator where a person can search one time and they can get information from all of these websites. And we're constantly adding other information, like we're working with the Department of Labor now, and we'll be working with other federal agencies so we can have all of that information in one place, and so it'll be one-stop shopping for people who want HIV and other provider and services information. So on to the next page, you can see what the locator looks like on our website. So if you go into the locator, there's links on our website, or you can go to locator.aids.gov on your own computer. And you can type in your zip code, and once you type in your zip code, it will give you, dots will start popping up onto this map. And you can see here, this was a search done in San Francisco, and you see the check marks are for HIV testing. There's a little house for housing assistance, health centers, mental health, substance abuse, and family planning. So within 5 miles of this zip code, you have almost 200 different providers here you can get the types of services that you're looking for. So then if you go to the next slide, you can also just check one at a time. You don't have to see all of those services together because it can be very overwhelming to see 200 providers. So you can go, as far as just checking one, HIV testing, or on the next slide, you can just check two. So this one shows HIV testing and housing assistance, or on the next slide. You can see them all, and then if you click on each one of the little icons on the map, you can get more information about each of the organizations. So it tells you their name, their address, their telephone number, the categories, like what type of service that they are providing, how far it is from the address you put in, and what the source is. So since we collaborate with so many organizations, you can see here for the San Francisco AIDS Foundation, the source of that is the CDC INPIN. And then we also give you an opportunity to suggest corrections, so you can suggest changes right there on the website, and it'll take you straight to the person who is in charge of that data set. So now if we go on to the next slide, you don't have to just get this locator on our website. You can also go to our mobile website. So if you have a smartphone or a cell phone with web capabilities, you can go to AIDS.gov or directly to our mobile website, which is M for mobile.aids.gov. And our locator is there as well. So if you're out and about, or if you've just had a conversation with a client at their home, you can whip out your phone and you can find services right then and there. You don't have to be at an actual computer. And so on the next slide. Where you see here in red where it's circled, you can enter your zip code, and you can find services that way. Or on the left-hand side, if you have a mobile phone that has GPS technology and you allow it to know where you are, you can click Near Me, and it will tell you exactly, it'll tell you the services and providers that are near you. So if we can see an example of that on the next slide. So it will request your current location, just as I mentioned a second ago, and you can allow or don't allow it. So if you allow it and you click OK, then on the next slide you'll see the results that you get. So you can get it one of two ways. You can get it in a list format, as we see on the left-hand side, where it lists each of the providers there in a list format, or you can do it in the map format, similar to what we saw online on the right-hand side. So it's very simple, and it's very similar to our web-based platform. Next slide. So you can find this resource in many places, not just on AIDS.gov website and the AIDS.gov mobile platform. We've also turned the locator into what's called a widget. Next slide, please. So a widget is something that anyone can take and put on to their own website, and you will still be able to access all of the databases, and all the search information will be embedded right into your website. So The widget, as you can see, it's pretty small, so if you just have a resource page or something like that, you can put this small widget onto your website. So as you can see, it looks a little different. It has 4 tabs. So the first tab is the regular search tab, so you can just type in your address, your city and state, or the zip code. You can click the services tab, and you can put in your location, and you can change what the distance is you want to search. And then you can also select exactly which services you're looking for. So you can search for one, some, or all. And the next thing you can do with the widget, which we think is very important, back a slide, is that you can share this widget. So if you see here on the share or embed, one is embed code. If you click on that, that's actually the code you would give to your webmaster or whoever runs your website, so that way they can put the widget onto your website. You can put it onto a blog. You can put it on pretty much anywhere. But also, if you want to let people know about the locator, you can share it on Facebook, email it to a friend. There's many ways that you can share. And then the last one tab is help. So you can provide feedback, because sometimes organizations close and things like that, and our database isn't that up to date. So it's very easy for you all to email us and say, hey, I called that number, it's disconnected, or hey, this is my program, and we have a new location. So it's really useful to us, for everyone who's using the locator, to help us keep it up to date. Next slide, please. So the last thing I'd like to talk about is something that we just introduced, and this is our Facebook locator. So if you go to the AIDS.gov Facebook page, which is Facebook/AIDS.gov, we have the similar web format here with the Facebook page. So you can type in your address, or you can type in your zip code. It also will do, based on your location, if you allow your computer to know your location. And it works very similar to the way the mobile and the online platforms work. So you can see here we put in an address, and you can see on the map exactly where all of the services are. So that is a new feature that we just released in the last couple of weeks. You guys are the first people that we sort of announced it to. So if you're on Facebook and you're a friend of AIDS.gov, please check out our page and let us know how you like our new Facebook mobile locator. And we have customized it so where it doesn't show up on your timeline that says, hey, Aisha Moore just used the AIDS.gov locator to find HIV testing sites, because we know it's very important to protect confidentiality. So if you use the Facebook locator, it will not put this onto your wall or your timeline or show anyone that you've been using this. Next slide. I believe that's my last slide.
It is. Thank you so much. We appreciate your time on today's call. We have our last presenter, last but not least. It's Carol Creasy from the Administration on Aging. So, Carol, I'd like to pass things over.
Thank you. In 2009, people aged 50 and older accounted for 23% of AIDS diagnosis in the U.S. Yet older adults are often overlooked in ongoing HIV and AIDS conversations. HIV can go undetected in older people because of the symptoms associated with it, such as weight loss, pneumonia, and fatigue. That also occurs frequently with age. AOA developed a toolkit for states, AAAs, tribal organizations, senior centers, and other local service providers within the Aging Services Network. This toolkit contains helpful resources and materials specifically designed to inform older adults about the risk of HIV and AIDS and to encourage them to know their status. To access this, visit www.aoa.gov and click on the HIV/AIDS Toolkit button. You'll see that on the slide now. It is an important place where you can get information that we have made available. We had hoped at this point to show you the toolkit video, But even though a silent movie is up for an Oscar, I don't think you would be interested in 5 minutes of a silent HIV video, so we're not going to be able to show it to you today. But if you go to the www.youtube.com, and you'll see the rest of that on your screen there, please take a look at it. It's a wonderful 5-minute video that you can use in a variety of settings that gets the message across that HIV and AIDS has risk for older people. The Toolkit really is very engaging, and I think, again, if you hold discussion groups and webinars and health fairs, and maybe we can figure out a way that it can work on a webinar and let you know how to make that happen as well, we think it'll be a very helpful resource for you. Now, take a look at some of the things that we have in the Toolkit. On the left-hand side is the Toolkit fact sheet, HIV, know the risk, get the facts. If you're hosting an educational event, print a few extra copies for event participants to take home, or just take them to and have them available in your office or senior center. On the right are a few slides from the Toolkit's customizable PowerPoint template, and that's the key thing there. It is customizable, so you can pick and choose those things that are going to work for you depending on what setting you're going to be in. The template provides key facts about HIV and AIDS among this population, but it also leaves space for you to add information relevant to your community. So we want to make sure that it fits your needs. The last slide I'd like to share with you today is a Toolkit poster series. By putting up posters in places of interest, you can help raise the level of HIV and AIDS awareness among older adults in your community. Your own facility or an office is a great place to start, but put posters up in local grocery stores, pharmacies, doctors' offices, senior centers, and any place that older people congregate. We believe that this is an important tool that you can use to raise awareness. And at this point, we'd like to take questions from folks, and I'll pass it back to Danielle.
Can we please have the operator open up the audio lines to begin the audio questions?
Thank you. At this time, we will begin question and answer session. To ask a question, please press *1 on the touch-tone phone. Please unmute the line and record your first and last name when prompted. To withdraw the question, press *2. Once again, please press *1 to ask a question. One moment, please. Our first question. I need to listen to the name. Our first question did not record their name. Your line is open. If you press *1, your line is open. Go ahead with your question.
Hello, this is Jessie from Seattle.
Hello, yes.
Hi, and my question is for Aisha. We were sitting here. We've got one computer with the webinar on it, and another one we were bringing up the Locator thing, and we were wondering where it was that you got your information from to populate that information, because if we look at the information on Seattle, there's a lot of things that really do not provide services to people with HIV, and virtually none of our HRSA-funded programs are on there.
The information comes from other federal databases. So the HIV information, some of it comes from CDC, some comes from HRSA, but it should include anyone who's funded by those agencies. But I think that's definitely something we need to look into.
Yeah, I mean, none of our Ryan White Part A, like the Part C funded clinics are listed, but none of the Part A funded or Part B funded things are on there.
Okay.
Just so you know.
Right, thank you.
Great, and while the operator takes the next audio question, we have a question in chat here for Deanna from HRSA. The question is, are AETC services free to aging service agencies?
AETC services are free in terms of training and so on. The only caveat to that is remember that the target population for most trainings are clinicians. Now, if it's a social service agency, that doesn't mean that they're not going to try to help you. But in terms of most of the training and case consultation and so on are for clinical services. So, but they are free.
Wonderful.
Would you like to take the next question from the audio portion?
Please.
Ms. Sheila James, your line is open.
Hi. Could Carol put the slide with the YouTube website back up, please?
Yes, and actually,
the Toolkit.
Thank you for bringing that up. I would like to tell everybody, if you go to AOA.gov, the button on the right-hand side, it's the third button on the home page. It says the HIV and Aging Toolkit. If you click that, the link for the video is right there, and it also includes all the other toolkits. So go to AOA.gov, and you'll see the third button on the home page. It's the HIV and Aging Toolkit, and you'll have all the videos there, the PowerPoint template that's customizable, as well as the poster series, fact sheet, and so on. So thank you for that question.
I back up anyway.
And I will go ahead and put the slide back up in the meantime. If we could have the next audio question, please.
Ms. Grace Terry, your line is open.
Hello?
Hi, yes.
Okay, I was wondering, well, first of all, I appreciate the diversity reflected in the posters that come with the toolkit. For the other materials, other than the posters, can those images be customized with the diverse racial, ethnic, and sexual orientation couples?
Yes, you can customize, for example, the PowerPoint toolkit. You can use all the photos from the poster series, and you can copy and paste those into the PowerPoint, or just print the ones with the, for example, ethnic background that you choose.
Right.
Can we take the next question from the audio line, please?
Ms. Dorcas Baker, your line is open.
Hello. I want to first of all thank everyone for their presentation. I'm Dorcas Baker from Johns Hopkins AETC, and I really appreciated Diana's presentation, and I'm happy to report that on March 20th, we'll be having our Graying of HIV at our local performance site at Shepherd Pratt, and 3 of the panelists that came up with the new recommended treatment strategies for older adults through the Academy of HIV Medicine and American Geriatric Society. They will be presenting, and I just wanted to put that out there in case some of you would like to be able to attend that conference. We're expecting 150 individuals, but they will be there, and I really thoroughly enjoyed everything that has been presented, and thank you.
Thank you, Dorcas. They've put on a wonderful presentation and conference I have attended in the past.
Wonderful. And Dorcas, could you tell us how to get contact information for that?
Yes, if they would visit the Pennsylvania Mid-Atlantic website, which is www.pamaetc.org, and that brings up our entire region for Pennsylvania Mid-Atlantic, and all they need to do is click on training and look for Johns Hopkins.
Great. Thank you for sharing.
Also there.
And also the website for the AETC National Resource Center. If they go to that, there's ways to link to the different, all the different regional and national AETCs. They can link to those emails, those websites, and then subsequently link to the trainings as Dorcas just mentioned.
Exactly. Thank you.
Thank you, Dorcas.
We have several chat questions, so let's take one now while we have more audio questions building up. This one is from Deanna from HRSA. The question is, do AETCs provide training on how clinicians talk with seniors about sex and STDs, including HIV?
Some do, and maybe some more should. I think that, as I mentioned, the trainings have to do with what is. It's kind of driven by the request of the targeted audience, of the people who want to hear this. I think that this is a topic that definitely has been addressed and can be addressed. It's just that it's perhaps I have a skewed interest in working with people living with HIV who are older, so I have an interest, and I think it should be done more so. But that doesn't mean that it doesn't happen. It does happen. It just, again, it has to do with a request from the agency or the targeted audience for the training.
Thank you. And Operator, if we could take another audio question now.
Thank you. Our next question is from Anthony. Your line is open.
Yes, this is Anthony, and this question is for Diana from Florida. I was wondering, with seniors' participation in health fairs for HIV testing, was there any type of pre-work that was done with them to help them with the stigma associated with it? We are invited to a lot of health fairs here in Alabama, but seniors tend to actually run away from the table or not come to it when they see that it's HIV-related, and wanted to know if there was any pre-work that was done prior to getting them acclimated with HIV testing.
Asking Joan in Florida? I don't know if I misunderstood.
No, I'm actually in Alabama. I'm sorry.
Okay, you were directing it to the...
Diana I think she was from Florida.
I used to be from Florida, but
okay.
And I'd be happy to answer, but I think that the answer would be better suited to Joan.
Okay.
Well, thank you. Actually, that's an excellent question, and we have not found that to be true, especially, I think, given the local nature of what we do, going into churches, faith-based type of groups. I think seniors have been used to our presence over the years. They want and need health care, health access. We offer it as a service to them. Okay. And they and what we will see typically is one or two will sign up, and then the rest of the group will follow. And I think they all feel very comfortable with it, just by the nature of how it's done, very privately with dignity and respect, and so we have not had that issue at all.
Okay.
Fortunately.
This is Deanna, and I'd like to just weigh in. I think that part of the answer to that has to do with the normalization of HIV, and that it is an illness, just like hypertension is an illness, and all diabetes and so on. So I think that the when it becomes more normalized, and the fact that it is important to know your status so that you can get treatment, I think that appeals to the senior population, especially if, as Joan said, it is provided in privacy and with respect and so on. That's been my experience in terms of providing the clinical services.
All right, thank you very much.
Charlie Inlet, just one comment. Over the years, I've been asked multiple times by senior service agencies and senior housing complexes about this issue. And one of the things that we found similar to your question about stigma was we broadened the topic a little bit, and the topic became aging and sexuality. And then it opened the door for conversations about HIV disease. But even if you're not interested in HIV, you might very well be interested in a lecture or a conversation about aging and sexuality.
Thank you.
Our next question is from Sean Lang's line. Your line is open.
Great. Hi, this is Sean from Connecticut, and the speaker just mentioned senior housing, and that's a real consideration, I think, as people are aging with HIV. I mean, housing is the single most unmet need for people with HIV, and HUD wasn't part of this presentation, but I wonder if there are conversations going on with HUD about this particular population.
Would you like me to take the next audio question, or would you like to take it from the net portion?
I'm happy if anybody can respond to that.
Is there any conversation?
I'm not aware. This is Deanna. I'm not aware of anything particular, but I'm not that cognizant of the HUD. I am cognizant of what HUD does, but in terms of what they're doing specifically with this targeting this population. Danielle, do you at AOA have any kind of information on that?
We're not familiar at this time with anything HUD's doing specific to this population, but we will get back to you on that. If you'd like to email me again, it's danielle.nelson@aoa.gov. I will look into that for you. It's danielle.nelson@aoa.hhs.gov.
Great, thank you.
And we'll take the next question, please.
Thank you. Our next question is from Jamela. Your line is open.
Hi. It has two parts. One, it stated that you guys stated that HIV risk does not diminish with age. So my question is, what steps are you guys already taking, or what steps can be taken to get younger people involved from different areas of health and services, or even the same way where there's like campaigns to get younger people to talk to their peers about HIV and AIDS and cigarettes and drugs? Is there a campaign or a project to get younger adults to talk to their parents or to their older caregivers about why they should be tested as well?
We're not, at AOA, we're not aware of anything at the moment, but it is a great idea, and we will look into it.
Okay.
Thank you for bringing that up.
Okay.
Once again, you may press star 1 to ask a question.
We have some questions in chat that we'll take now while we're waiting for another question to come. This one's for Deanna from HRSA. The question is, do you work with any of the, for example, CDC HIV and AIDS trial patients? Is there any collaboration with that?
Well, the AIDS education training centers do work closely with many of the other programs around CDC funded, for example, the prevention training centers and so on. Now, in terms of clinical trials network, that clinical trials are promoted as, a good thing that people can participate in, but it's not like it's not a collaboration necessarily. I'm not sure I'm clear on the question other than that. I mean, we do collaborate with many training partners, and in terms of clinical trials, it is something that is promoted, but it's not, not necessarily a role for the AETC. We're about training and providing education.
Thank you. The next chat question is for Aisha from AIDS.gov. The question is, has there been any interest in including mobile testing locations with the Locator tool? This person belongs to a coalition that's trying to figure out how the best way would be to do this live, since they're considering real-life issues such as changing of venues. So if you could take that question.
I'm not exactly sure if I understand the question, but the Locator is available on mobile, and previously, and I'm going to check right now, there was a text version, but if the person who had the question, if they could send me an email at AIMOORE@jsi.com, I'd definitely be willing to help you look into that.
I'll forward the person's name on to you. And
Thank you.
They're interested in mobile testing, so we'll look more into that and get back to the person.
Okay.
If we could take an audio question at this time.
Thank you. Our next question is from Nancy McCreary. Your line is open.
Yes, hello. This question is for Carol. I represent CDC's direct-to-consumer team, DHAP, and currently I'm in charge of writing fact sheets, and I have been working on one for HIV among people 50 and older. And you mentioned a statistic on your slideshow about 50% of people over 50 will have HIV, will be diagnosed with HIV by the year 2015. And I would like to know where you got that statistic from, because we've been trying. I've even consulted with John Brooks, Dr. John Brooks, who's an expert in that field, and we've been trying to figure out where that statistic comes from. And you would help us out a great deal if you could tell us.
The stat that you're referring to, you might have the number wrong exactly, but we did get it from a CREA, and it's actually that people age 50 and older accounted for 23% of AIDS diagnosis. Or are you talking about the one that was in 2015, half of people living with HIV will be over 50? Is that the one you're referring to?
Yes, and also it seems to change every year. Like with my research, I find it somewhere it says 2014 or 2013. Now it's 2015, and I think it went back to one of our surveillance reports, but it's not there.
Actually, this is Charlie. I think I might be able to answer that question.
Thank you.
There are two citations I use to support that figure. One is an article that was written by Amy Justice that was published in 2010 in the journal Clinical Infectious Diseases.
Okay.
And and if you email me, I would be glad to not only send you the citation, but I could probably find and send you the article. The other source that I've seen was a couple years earlier in an article by Rita Efros, who I believe is at UCLA, and the exact source of it was, again, a peer-reviewed publication having to do with infectious diseases, but I can't pull the citation out of my head.
Okay.
But a common citation is Amy Justice's article in 2010 in Clinical Infectious Diseases.
Okay. Okay, thank you.
Yeah.
We have another question from chat here, and the question is for any panelist who's able to answer it. Have any of you included congregations as targeted entities in your services to older adults? So maybe Joan from Florida, do you know of anyone in Florida that's targeting congregations?
You mean you're talking church?
Yes.
Church congregations, absolutely. Not specifically, but in our experience, again, in West Palm Beach, we have had pastors and the leadership of churches actually approach us about having HIV and AIDS testing and about really being there to champion the cause for this and really being a cheerleader to encourage their congregants to get the testing. I think that's so important, especially in some of these areas where we go, because that individual pastor becomes a role model and really becomes someone who says, this is the right thing to do, this is a safe thing to do, and really, I think, it makes a big difference in the trust level that members of the congregation do feel. Most of the time, we have gone into churches to do this testing, and in one time, we've actually used the pastor's house as a private testing area and counseling area. So I guess you can say, that it's pretty much, I think, getting the pastor to champion the cause makes a huge difference.
And I did want to mention also and answer this question, here at AOA, Carol, one of our presenters, is one of the people on our video that we were not able to watch, the 5-minute video we hope you watch later, and she does briefly speak about her church. They had a health fair, and there was a free HIV testing at the health fair. So another plug for the Toolkit. We hope you will see that video and enjoy that. We'll take our next audio question, please.
Our next question is from Dennis Yaver. Your line is open.
Oh, thank you very much. Actually, my question had more to do with the getting the resources from the presentation in terms of the slideshow, the slides from the presentation, and I realize that it says here on the computer that they're located on the website, but I can't find them.
Yes, this is Danielle from AOA. The Toolkit right now is posted, but the actual webinar slides, they'll take 7 days to be posted because we'll have to make sure they're 508 compliant, which means that they're accessible to all. So it'll take us about 7 days to get this PowerPoint recording slides, but it will be where the Toolkit is. So when you go to AOA.gov and you click on the button that says HIV and Aging Toolkit, it'll be under there. So check back with us in 7 days.
Thank you so much.
You're very welcome. We'll take our next audio question. We have about 3 left.
Lorette, your line is open. Lorette, go ahead with your question.
Can you hear me?
Just barely. Let me try to increase your volume.
Am
Let me see if I can get off the speaker.
Go ahead and say something now.
Is that better? Is that better?
Yes, it is. Thank you.
Okay. I have a two-part question. In terms of, and I guess this is open to the panelists, so we're talking about older folks with HIV, and part of the cohort was to look at people who already knew and have been in medical care for a long-term period of time, 20-plus years or so. Has the panelists found any, are they aware of any, long-term studies of being on these medications and all the complications? And now what are we seeing in terms of as the body's aging, as they're aging, any other issues that need to be, kind of like a yellow flag or something like that, that this may, have different implications for those older folks versus, non-HIV folks?
This is Deanna. I'm not aware of a particular study. That doesn't mean that this is not an area of interest that may be that someone may be doing a research study on. It definitely is an area of that we need more knowledge about, as to especially those that have been living with the virus for a long time and have been on antiretroviral therapy. There has been some hypothesis that some of the sort of adverse events or adverse effects that we're seeing may be due to the medications, but it's difficult to tease out. Is it the medication? Is it the HIV disease? Or is it just a natural process of aging? So I think that this is an area that's ripe for additional research. I'm not cognizant of if anyone specifically is studying, I'm sure there are, but I just don't know of anyone specifically.
Charlie Inlet. There has been studies done on that. For example, long-term use of antiretroviral therapies have been found, at least in some folks, to increase triglycerides, and then, so there's some impact in cardiovascular health. I can't come up with specific citations off the top of my head, but I think if you look at perhaps Journal of the American Geriatric Society, Journals of Gerontology, you'll find that there's a researcher whose name is something like Des Kelbey, and he's been doing some work on aging of HIV and what he calls a frailty phenotype that suggests almost the advanced aging process of people with HIV disease. So there's a lot of stuff out there. It just takes a little bit of time to look and find it.
From the American Academy of HIV Medicine, that guidelines or guidance that I mentioned earlier, I'm sure that some of their the people that have authored or co-authored that, probably you might find citations about particular studies that they might be doing.
Wonderful. Well, this completes the end of our time together today. I do want to thank all of our presenters. We appreciate your time in being here. And again, for any of our participants, if you did not get your question answered here today, please feel free to email me. That email is danielle.nelson@aoa.hhs.gov. Thank you for everyone's time, and we hope you have an enjoyable rest of your day.
Thank you.
Thank you.